Okay, the number of times I have procrastinated this topic, but I recently heard a podcast about how women tend to downplay their pain, especially in medical settings. And I just felt like there might be someone out there who would need to hear this or feel like someone relates. And so, welcome back to Stories About Life podcast. Today's episode, I decided to talk about my story about how I went through PCOS, a hormonal imbalance, and yeah, and the whole health journey, well, health struggles, really. PCOS stands for polycystic ovarian syndrome, and essentially it means there are little clusters of cysts in your ovaries, which is the woman's reproductive system, in the woman's reproductive system. That's what I meant. Yeah. And so it was only early this year, back in February, that I found a mass in my uterus. Well, the doctors found it because I can't go in and scan it myself. So, and they confirmed my PCOS diagnosis, which I kind of already knew I had, but I never knew it could be treated, or like I didn't have to face it alone in that sense. So that's why I want to talk about this today. Back in February as well, when I heard about, I found out about the mass in my uterus, I did feel a lot of things and I journaled it, which I'll share a bit later in this episode. But essentially, I'm fine, guys. Like, I didn't have to go to the hospital. I thought I might have to go for an operation, but the doctor said that since it's less than 5 cm, so it's okay to let it be. But I have to keep going back about every 2-3 months to monitor whether it's grown. So if it starts to grow exponentially and beyond 5 cm or 5 cm and above, then I would need to go to the hospital. It's a funny story because I found this clinic because I was helping out another friend who didn't get her periods at all. And I accompanied her to this clinic where they confirmed her diagnosis of PCOS and looked at her blood work and helped her out essentially. But so how did I even think to get the mass checked? Well, if those of people who know me, I do try to monitor my health quite diligently. So I noticed that when I started doing resistance training under a coach, actually I've changed multiple coaches, but yes, under a coach, and started to build more muscle mass and generally feel healthier, I noticed that my period cycles, so became shorter, and the period flow was not that high as well. So, for context, my period cycles used to be pretty unpredictable, but it'll be like 30 days, which is normal. Then sometimes it'll be 40 days. And as long as I experience even just a little bit of stress, whether it's work or physical stress, it will just go into 40 days. I would say like 40 days is kind of the norm to me. So when it started to move toward 30 days, 28 days, I was like, oh great, I'm getting healthier. I feel more fit as well. But then in January, I started to notice some spotting. Even after the menstruations period. So I immediately knew, or not immediately, but I did feel like something was off. So that's when I went to the clinic and they did a scan. They basically put this wand they put a wand up your vagina and look into your uterus, and that's when they found the mass. They were a little worried that it could be a fibroid. Maybe it still is. And I didn't go for a biopsy because it would be another something quite invasive, and it was below 5 cm. So I think at that time it was about 4 cm in diameter. So kind of close. But it was 4 by 3. So the doctor was like, okay, let's just monitor it. And then as she looked in and saw, and then she was like, oh, you have PCOS. And I was like, yes, I do. And then she said, but it's pretty mild. But you do have it. I was like, oh, okay. That's reassuring. But I guess I got really worried at that time, like whether I need to push back things or account for whether I might need to go into surgery, because she said to come back in a month. So felt kind of anxious, felt kind of stressed, felt a bit down about the whole diagnosis. And just so happened at that time, I was scanning. Yeah, I was scanning some of my old photos. And I came across a photo of myself at 16 years old. It was quite a close-up photo of me, and all I saw in that photo is the discomfort and pain I would have been enduring with all those painful cystic acnes on my face. It has been worse than that photo, but I was remembering how painful it was, and I basically ignored my pain, lived with it, with the discomfort. But looking at that photo, I just remembered, wow, I thought that's just life. I have to be with this discomfort and pain, and just go through life. Looking back at the picture now, while I was in that picture, I was actually on a youth exchange in Japan. And to get that, you have to be a good student, you have to demonstrate that you're active in the curricular activities, and that was all that. And but I guess what no one saw was actually me pretending, I guess, or pretending everything's okay, which is fine. And I mean that kind of mindset allowed me to do all sorts of things and that are actually meaningful for me at that time. And in spite of that discomfort, or even maybe that pain and shame of being presented like that, essentially it's a bunch of boils and injuries, right? Wounds on the face. So that was something that affected me, but still now thinking about it, I'm kind of proud of her, like proud of 16-year-old Sue for just still living life and engaging in meaningful activities, or at least what she knows, in spite of all of that. So just to rewind back a bit, I think I've always had PCOS. Even when I was 12 years old, basically, when you hit puberty and you get your first menstruation. I forgot what sort of triggered me to go and get a checkup, but I have this really, really, really nice, really kind, very patient family doctor. She's a GP. Shout out to Dr. Ui of SS15. She always takes the time to explain things and listen to what you're going through before she drops the diagnosis. And she always looks at all her patients as a full human, what they might be going through life, right? Anywho, at the time, I think I was 12 or 13, must have had something going on. Maybe my period was kind of irregular. So she suggested that I go get a gynae checkup. And at the gynae checkup, suddenly I got hit by a memory of the hospital gynae. Although she was a woman, I wouldn't say she. I mean, I'm so spoiled by Dr. Ui that seeing someone else who is not as warm, I did not like that experience. She just did the scan. Like ladies, if you had this scan before, it is not comfortable, right? It's just so uncomfortable, and you're just like, relax, it'll be fine. And no, it is not fine. It is a freaking. Have you seen, if anyone who has seen the device that they use to hold your freaking vagina open, it looks like a torture device. I mean, fair enough. Like sometimes you gotta use certain tools to get the job done, right? I'm sure surgery has a lot of scary ass tools. But it's cold, hard, painful. They say like, oh, you feel a little pressure. No, I know it's pressure, but it's still very painful. So this part of me just putting it out there, not downplaying the freaking process or the experience. So anyway, she does that. She does scan, and she does find clusters of cysts on my ovaries. Doesn't tell me anything. Just say, oh yeah, we found some cysts, and then like I don't know what the hell that all means as a 13-year-old or 12-year-old, can't remember. And I go back to Dr. Ui, and well, she did explain what it is. She said like sometimes the cyst comes out because the eggs are not mature enough, and then they try with another one. So these are like little small, not good quality eggs in a sense. So she was very patient. She even had a model in her um, clinic. I really liked it. She always had all these models and pictures, helpful ones, diagrams, I mean, and she would explain it. And super helpful. Totally spoiled, as you can see, to have such a caring, patient, willing to teach kind of GP when I was young. So she explained it, and then she said, but with your age, it's a bit hard to say if you have PCOS because you don't present the same. Usually, PCOS presents as someone who's overweight or obese, and just losing some weight actually helps the symptoms. So she said, maybe for you, it's a bit hard to tell because you're 12 or 13, your hormones are still trying to balance itself out. So I was like, okay, I walked away with that. I'm like, okay. And then she's like, but what you can do is still, just watch your diet, keep a healthy lifestyle, and see how it goes. So I did that. But I guess never went back, although I did feel, I can't remember exactly what was happening, but I did feel like my periods were not normal per se. And that brings me to the next issue I had, which was when I then had follow-ups, just normal checkups with gynaes or doctors. And they'll ask me about how my period was. I didn't know what to say. Like, I didn't have the words. Like, no one, not my mom, not any other role model, not my friends. We don't talk about our periods and how it is. I do remember one blogger writing about how painful her periods were. And I don't know what she did in the end, but she was she was a fellow schoolmate, senior, who was talking about how painful her periods were. Like, they debilitated her. She couldn't go to school. Like, she couldn't get out of bed. It was so bad. I was like, oh, mine's not like that. So maybe, I guess my answer to how my periods are is I'm okay. I guess. I didn't know how else a period could be. So I just said, yeah, it's fine, I guess. But throughout all this, I always had trouble waking up. I still kind of do now. They're just not as bad, but but then you think, like, because you're a teenager, so it's like, hormonal issues, everyone wakes up late and stuff like that. I always had this trouble waking up and then experiencing fatigue throughout the day. Sometimes it's kind of hard. Like, I don't know how I did get through studies or school, because sometimes when I try to think back now, it feels like a blank in terms of actual classes. Because I was just so tired all the time. It was so bad because, like, sometimes I remember having tuition classes. At least tuition classes kept us awake in a sense. We usually have to squeeze in a lot of students, and I have friends. Like, we get to chit chat, and the teachers were a lot more intense because they only have that amount of time to teach whatever they need within the week. But there were sometimes I had one-to-one tuition classes. I would just fall asleep. Like, if the teacher is just not engaging, I would just totally fall asleep. Not out of boredom. It was just yes, boredom, but it's just that I was perpetually tired. I remember even to primary school, I would come back from school so tired. I would take a nap. I'll be hungry and tired. So I used to have Maggie Mee I don't know whether this contributed to eventually when I hit puberty, my hormones being all messed up. I have no idea. Okay, but I love noodles. They saved my life in the sense that every time I come back from school, I'll be so hungry. Dinner won't be ready yet. And so I think my mom was like, oh, it's okay, just have a pack of Maggie mee then. I mean, it's fine if you do it maybe. Okay, the point is after I have my Maggie mee, I would take a nap because I'm so tired from school, and then I will wake up in the afternoon. Yeah, so that contributed to my chubby years in primary school. Anywho, yeah, so this perpetual tiredness, it became a norm to me. And again, I did not know how else one could be. So going back to that question, how are your periods? How are you feeling? I don't know. I never knew how to answer that. Like, and I realized when I listened to that podcast, when it was medical doctors on this podcast, the Diary of a CEO, and they were all talking about female medical issues. So this medical doctor said that she realized that women tend to downplay their pain in the office, the doctor's office, and that's due to having been dismissed many, many times. And I also thought like my symptoms were always kind of in between, like I said, although it's 40 days, technically I still had period every month. And then I don't present as overweight, so looks like I'm fine. The only thing is acne, which brings me to the next point. So all teenagers have acne problems, right? They'll have pimples. And so when I had my acne problems, the whole attention was on my acne. And although backtrack to Dr. Uni, she said, just keep up a healthy lifestyle, which I did. Like there are so many snacks, childhood snacks that people, like my friends, talk about that I don't remember eating that at all. Yet everyone looked at my skin and immediately thought, the immediate advice coming out was like, oh, don't eat fried chicken, don't eat fried foods, don't eat all the junk food. I'm like, I don't. Okay, besides Maggie mee, but by the time I was a teenager in secondary school, I was not eating Maggie mee like on the regular anymore. And with the whole acne thing and trying to keep up a healthy lifestyle, because at that time also my dad would had health issues, so we all as a family and my mom as well would make sure food at home is healthy. And generally I just I wasn't like a snacker, not that much, so I didn't even eat like biscuits or junk food or anything as such on the regular. But yet my skin seemed to give everyone the permission to tell me how to jaga my diet. And I'm not blaming them. It's true, it works for certain types of acne. But looking back now, I realized that acne was a hormonal thing. Yet I was given things like antibiotics, didn't help. Accutane, supposed to help kind of, I feel, on the surface, because there'll be certain periods when it gets stressful, maybe, I don't know, a change in diet or environment, then the cystic acne will come back. And Accutane, I don't know. Maybe again, it was very hard to tell because teenager hormones. I felt pretty depressed. I wouldn't say I was clinically depressed, but it was like no drive to live, to just do anything really. And I remember it was so bad. Like I was very active. I had dance, I had taekwondo, I had that I'll go play in the playground. I wanted to say basketball, but I really did not take that sport seriously at all. I just just like being at the playground. I just recalled my friend being so pissed at me for not taking the sport seriously because she was a quite a serious basketball player. But I just wanted to go to the playground and play. And generally, I would run back to the swings, just swing around. And yeah, so almost every evening I'll be at the playground, cycling as well, monkey bars, climbing trees. Yeah, so generally quite active. And food, mostly home cooked food. Most of the time, we don't really have deep fried food either at home. So I digress. Sorry. But I remember that time because of all this judgment on my acne. I actually avoided the mirror. I had to keep changing products as well, and I hated that. Like I hated like they were like, oh, you have to scrub, and then after you scrub, then you must like put a facial mask, and then after that you must moisturize all the shit back out. I mean, totally valid advice again, but it was a lot. I just felt too tired to deal with all that on top of the effects of the Accutane. Yes or no, don't know me, it's hormonal. Again, I did not know how to express what I was going through. So, whoever is listening or needs to hear this, please just, it's okay to feel how you feel. I was just trying to cope and grit my way through all that I was experiencing. Again, I didn't know any better. Don't blame myself nor people around me. We just didn't know. It's almost such an invisible thing. But yeah, I throughout my teenage years, when I put all the products on my face, even when I tied my hair, at least when I first learned how to tie braids or tie my hair, usually the first time I'm learning the hairstyle, I'll look in the mirror, but I'll be focused on the hair, of course. But truth be told, I always avoided looking at my face. I would get ready in the dark every morning for school. And I just told myself, I don't give a shit. Like, I mean, kudos to my dad for kind of helping my self-esteem, because he was like, looks are not everything. Let's focus on leadership skills, charitable activities and your studies, so and being active and trying all sorts of things. So that really helped. But again, I didn't realize. I didn't want to look in the mirror. So I'm telling you, from 13 till actually even my 20s, I didn't like looking in the mirror at myself. So I can tie braids. Up to now, I can tie my hair without looking in the mirror. And yeah, I mean, now I can put on makeup, which I do need to look in the mirror because I don't know where to put the thing otherwise. But like facial products and skincare stuff, I don't need the mirror. I guess it's a skill I developed because of that. Yeah. Sorry, I'm digressing so much. It's just like so many things going through my head as I talk about it. So if there's anything that I missed, or you're like, oh, you did not finish your story or sentence at some point, just let me know in the comments, something like that. Or reach out. Anyway, so like flash forward. Oh, I have to say, maybe I could share one more. So I had Roaccutane when I was a teenager. Didn't really work that well, so I stopped. It just dries you out because apparently oil is bad. But it's fair. Back then, the literature or the studies, science is to get rid of acne, dry the oil out of your skin. But then when I was in uni, I flared up again my cystic acne. And it felt so fragile. I mean, now I look back, even right now, how I'm experiencing, it feels so fragile. Like if I do anything even slightly out of routine, I something will give, something just gives. And so I think when I went to uni, there was a shift in environment and all that, and the acne flared up again. Had a doctor family friend, like my parents' friend, and he was very kind to refer me to his friend who's a dermatologist, and he said that, and he prescribed Roaccutane again. At this time, he said that actually my prescription from before was not the right dosage, because you kind of need to follow the weight of the person. And again, because people just look at me and assume I'm freaking light. Most people think I only weigh 47 at the max, or 45, because I'm kind of short. I'm 5 feet half inch. Yes, the half inch counts because I'm so short. So they assume I'm like 40 something, but no, I've never been that weight. I've always been at least 50. Highest is 55. Even now I'm thinking about 52. And yeah, so apparently this second doctor he said probably you were not given the right dosage, and hence the medication didn't really work. So he prescribed, that was so bad, and I felt really horrible because that time then the skin really flared up and it was really dry. Like I had to wear, like he prescribed with all the moisturizers and stuff. I never wear, even up to now, I never wear lip balm, but that time I really need lip balm. It was so drying. But good thing is I think I had quite a healthier diet and lifestyle, a lot of walking in uni. So at that time, I didn't get the depressive symptoms. But depressive in the sense that, oh my gosh, imagine waking up every morning and your face is just flared up like a red tomato and dried, so like pockets of volcanoes on your face, and so painful. The creams help. Thankfully, he prescribed those as well. But it's just not fun. Speaking of medication, flash forward to now. I went to the clinic, like I said, and because I saw the spotting, which is brown discharge, even when you're not meant to be having your period flow. So I went to the clinic, and they a bit funny situation. I don't want to get them in trouble, but anyway, long story short, they prescribed me with metformin, and I didn't really understand why, but they told me that it's a treatment for PCOS. I felt kind of elated to be taken seriously for once, I guess because of the mask, but at least someone took my PCOS symptoms seriously. And after taking it, I immediately felt a shift in my energy levels. And I never knew you were not supposed, you didn't have to feel tired all the time. This is where AI kind of came in. I used ChatGPT to kind of understand why did the doctor prescribe me metformin that's meant for diabetics. And I'm going to leave the details out, but it did then make sense to me because about now it's 2025, so I think back in 2018, so 7 or 8 years ago, I actually did go see a very popular gynae in KL who asked me proper specific questions, because I did come to her saying like I think something's not quite right with my menstrual cycle or hormonal stuff, and she started to ask my family history, and she asked it very specifically. Like she would ask, like, is anyone in your father's family side that has diabetes or any chronic illness? And as I listed it out, there were many of my relatives, both from my mother's and father's side. So my own dad had diabetes, and both sides, like my grandma from my mom's side, and yada yada, and my uncles, aunties, whatever, they all had diabetes. Not all of them, but quite a few of them. So she said at that time, in 8 years ago, then she actually then did proper body check. She went through almost like a checklist properly, not just a vague question of how your period's like. And she saw that I had scars, so she's like, oh, so you had cystic acne. Then she checked my chest. I mean, embarrassingly, I never really tell people, but I do have still up to now some cysts. It's not really acne anymore, it's just a cyst on my chest area. And so putting all that together, along with the scan, of course, she was like, yeah, you definitely have PCOS. It's not just a temporary hormonal imbalance. But then when she looked at my blood test, my glucose levels were not elevated and almost everything was normal. And she did a hormonal test. In fact, I think it's like FSH and LH. I don't know what they stand for, but essentially those are the hormones in charge of the whole fertility stuff or our women reproductive hormonal things. So there are two hormones there, right? FSH and LH. And then and actually on the test, it says both of those levels for me were within range. And at first I was like, okay, I really dread going to see doctors. So at first, when I picked up my results, the nurse was like, do you want to see a doctor or not? Part of me was kind of like, I don't want to wait some more, so maybe not. But then I was like, because the nurse was like, yeah, your results are fine, everything's normal. Then I was like, yeah, I do want to see a doctor, because I just wanted to understand what is going on with me, if everything is normal. But then she says I have PCOS, so end up seeing a doctor. She only had a very short amount of time because she's a very popular doctor. And she said, yeah, although your FSH and LH are within normal range, the ratio is off. It should be one is more than the other, but yours is the same or is the opposite. So I was like, oh. And then, this is the other thing. And I feel like doctors don't really take these things that seriously if you don't want to have a baby. She is very well renowned for fertility and helping people get babies. So she said you could go on medication, but or there are things you could take. Now, I was immediately already saying like I don't want to take any medication at that time, 7 8 years ago, because I felt like I could just do it on my own. Yeah. Yeah. So I said I can just, take supplements or, make sure my diet is well. And that's the other thing. She even asked specifically about my diet. She even listed, do you eat biscuits, cakes? No, I don't. I don't like sweet stuff. So of course, occasionally I do, but I don't eat it. I don't have dessert after dinner or anything like that. And then she said, oh, did you know you can't, like, even fruit juices has a lot of sugar? And I'm like, I know, and I don't drink it at that time. Well, in general, because fruit juices are kind of expensive, so I didn't I didn't buy or drink them. So then she said it herself. She said, oh, so you're actually quite healthy. Yeah, and I guess because that, although she saw like there was some hormonal imbalance, and she was like, well, you don't really want to have a baby. And I say I don't want medication, downplaying my discomfort and pain. Seeing that all my results are so-called normal, right? So I walked out there without anything, and well, yeah. So again, sorry, digressed, and flash forward to this year when she gave me the metformin, and then I put all that info from 7 8 years ago together with finally being prescribed medication, and realized, okay, it's just how my body is made. Have a family history of diabetes, so metformin addresses the insulin resistance that I have. And I never got into the diabetes level because I've always been very careful about my sugar and my diet. But because of that, I was tired all the time because my body doesn't. Okay, this one I asked AI ChatGPT to explain to me. But so why I was tired all the time is because my body, with the insulin resistance, doesn't process glucose very efficiently. So to make it into energy. So meaning like I'm already eating very little glucose, and my body just couldn't, it would not, or it would resist converting it into energy. And this is just what I understand. Please don't take my word for it, but it just made sense for me. And like, oh, no wonder, like, I never am really in the diabetes level, but I feel tired all the time, and I somewhat have symptoms like a diabetic person, because I remember no matter how much water I drink, I'm always thirsty. Like my mouth is always dry, and I didn't understand. And I thought I was like very good, right? I drink water all the time. But those who know me, I carry a big ass bottle wherever I go. I have bottle of water wherever I am, even when I'm out. So anyway, so suddenly it all just made sense. So apparently what the metformin does, again, apparently this is just my understanding, okay? I asked ChatGPT to explain it to me like when 12-year-old. So apparently, why am I laughing at myself? So with the metformin, it helps my body to process or take in the glucose and convert it into energy. So I guess that part really made me realize that I've been doing all the right things, and this is where I come to radical acceptance that this is just how I'm made. This is just how I am. And even now, it still feels hard to say, but in a way, I am sick. Yeah, I still had to say it in a way, but I'm sick, and I needed the medical support, the medication support. And I guess it was a bit of a relief because I didn't feel like I have to keep punishing myself for not being healthy enough, with the acne, the fatigue. And imagine, actually, I dread working out because imagine forcing yourself to do resistance training or going out to work out when you're so tired all the time, no matter how many hours of sleep I get. Yeah, and just admitting this is pretty hard, but at the same time, I was really proud of myself. I was like, wow, I was in discomfort. I was actually struggling, and I still am doing so much. I still kept up all those habits, healthy habits for diet and exercise as much as I could. At one point I felt like so unfair. I felt so unfair. I see like people, being honest here, I felt like there are some people who they can eat whatever they want and they're fine. And they don't feel sick or all the time, and they're so energetic. And here I am trying so hard and trying to do all the right things, and yet this was the first time when I got the PCOS diagnosis from that doctor 7 or 8 years ago. I actually felt that was really unfair. But flash forward to now, I have acceptance that it is what it is. In spite of that, actually makes things easier in a sense. In spite of that struggle, I still try to do the things that are helpful for me personally, was healthy for me personally, and then I just needed the extra boost of medication. And I felt so happy because it meant that I could now, like, health so important to me because I like still, okay, one thing, one bad not bad, but one maybe somewhat unhelpful lifestyle habit I have is I'm a bit of an overachiever. Like, I want to try everything. So hence why health is so important to me, because having my health, having my energy means I can do the things I want to do, even doing this podcast. Otherwise, it, like, even the slightest thing that throws me off was meant that I had no capacity to do it. And only just my last appointment 3 months ago, speaking of this whole radically accepting that I don't feel well and being able to assert myself with the doctor. And this way, yeah, it's helpful. Or just Google, technology is helpful. I can now actually ask questions, dive deeper, and of course the science these days is much more robust as well, especially for women. So because of that, I realized that another reason for my fatigue was I was experiencing heavy blood loss. I don't know why my body's like this, but again, radical acceptance is how I am. It's on the verge of menorrhagia, which means heavy blood loss from period. But I don't know when because I use a menstrual cup, I even have the exact measurement that I try to keep track as closely as possible. Usually it just goes beyond 80 ml, which is the threshold, by the way. And I told the doctor, and to the first time I told the doctor, she said, 110 ml, that's normal, I guess, for the first few days of your period. I was like, first few days, actually that's my 7-day period, then I lose 110 ml. and the cramps sometimes so bad, or the flow is so bad for the first 2 days that I'm just knocked out. I used to work through that. Some people have seen me or worked with me or even studied with me in masters. I was just like, screw it, even if my whole back of my dress is drenched in blood. I insisted that I am normal because all my results say I'm normal and all the doctors say, oh, okay, it's normal. So I was like, yeah, whatever is normal, right? To accidentally drench your back of your dress in blood. No, it's not. And I remember reading as well another point of, what is normal blood flow, because I also, like I said, I didn't know how to answer the doctors. Like they would ask, like, how much blood do you lose? I don't know. Like, how do I measure it? Right? That time I was using pads. Then when I looked it up myself, they said, like, okay, normal is like you change your pad every 4 hours for the first 2 days. I was like, oh, okay. Technically, looking back now, I needed to change my pad every 2 hours. But I would pretend those old doctors say I'm normal, right? I just insisted I wanted to be normal in my head as well. So I kind of disgusting, I know, but TMI as well. I kind of allowed myself to tahan for hours for the first 2 days. And that's why, to all those who had to witness my blood-stained clothes, that's why I always had leakage and was staining myself. Yeah. So, but now, especially after the metformin, this whole radical acceptance that if I feel like I'm unwell, I'm going to assert that I'm well. So the first time I told the doctor that, look, now that I'm using a cup, and I know online they say like more than 80 ml blood loss is menorrhagia, or it's, just too fatiguing or too tired. So first time she was like, oh, that's kind of normal. Second time the doctor asked me, how do you even know? No, actually, yeah, how do you even know that that's how you, how much blood you're losing? And I was like, because I use a cup. And then she was like, oh, okay. And I was like, okay, so losing more than 100 milliliters of blood doesn't seem like a big deal to you? Okay, fine. And I go through all the cycles, and my third was pretty much the same because I had to switch doctors, and then she also said like, oh yeah, that's okay, it's normal, you look fine, and and then but I think she actually took note. So the fourth time I saw that same new doctor again, and she was like, oh, so how's your blood flow? Is it like very heavy? I was like, yeah, very heavy. Then she's like, oh, as long as you don't feel like too tired, it's like you cannot function your normal everyday, then it's okay. Then I'm like, no, doctor, it's really bad. Like, I have to just stay. It's bad, and I have to stay lying in bed. And then she was like, oh, okay. So you can actually take this tranexamic acid that would help slow the blood loss. And I've come to realize not all doctors are like my GP who explains things. So I was like, okay, what is that? And she told me to go pharmacist and get it myself too. And she said, just take it first 3 days, see if it helps. And I was like, okay. Took me four times for someone to take it seriously that I feel shitty when I am bleeding from period. Anyway, so I went and I went back, and I had to look up like, what is this thing? How does it work? Again, AI or Google, please explain it to me like I'm a 10-year-old. And then I started to understand what it is. And then I went to the pharmacy and got it in my last period. I used it and it was so much more helpful. Again, I was like, oh, I actually don't have to feel so tired and fatigued and exhausted when I have a period. So, pretty proud of myself for persisting, and I feel like, I mean, at that point when the doctor said, as long as you don't feel blah blah blah, I had the urge to downplay it, which is what I've been doing. And I'm also coming to realize that this whole like overachieving, a bit of pride of I have high pain tolerance may not been so helpful for my health overall and getting the support and help I need. Though being this kind of stress ball, overachiever type personality has helped me in some ways, it all takes a bit of balance, and I guess I'm still in the process of learning all that. And health being such a big part of us being able to function, I guess maybe that's why I wanted to share this story, to say we don't always have to hold it all together. We might need to hold it together in some situations, and it's also okay to ask for help and support and persist in that, and to admit assertively, though difficult, like I said 4 times, okay, and I've learned how to be a bit more assertive in explaining my symptoms. I watched Dr. Mike, the YouTuber, who says what doctors want to hear and what they need to hear in order to give you a proper diagnosis. Did all that and still 4 times. Persistence, resilience. Just because you get rejected, if you feel you know you best, I feel like we can keep coming back and advocating. And speaking of advocating, that's what I actually journaled back in February when I saw that picture of my 16-year-old self with the acne. And I guess what came up for me was this line that I wrote and highlighted in my journal. What I want to say to teenage Suen is that I'm sorry. I did not know how to get help and ask for it for you back then. And I know the struggle and the avoidance of the mirror that you endured for years. I'm awake now, and I'll try my best to be an active advocate for your health. Even when you're faced with dismissive behavior. And just a shout out to, it's so hard to name people, but there's so many people as I came along in my life, and also for me to get into my thick skull that it's okay and it's important to listen to myself. And I think the thing I said at the end of my journal, and I want to say it now, is I love you, Suen. I realize now how precious it is to care for you, as how others also seek to care for me. And that's, in a sense, opening my heart to love, as in for others to love me and care for me as well. So I feel I like to stop here for today's episode and leave that message with you, and for all of us. Take care and see you in the next one.